Measles is a highly contagious and potentially deadly disease, which is easily preventable with the measles vaccine.
There's a new report, though, from the CDC and World Health Organization that shows deaths from the disease nearly doubled last year, spiking 43% after a dramatic drop in vaccinations during the COVID-19 pandemic. And the number of cases jumped 18% between 2021 and 2022. Now, these numbers are such great concern because, as you mentioned, Lauren, the disease is so preventable. In fact, the CDC estimating measles vaccinations actually prevented around 57 million deaths worldwide between the year 2000 and 2022.
This really begs the question, what is going on? Dr. Amish Adalja is a senior scholar at the Johns Hopkins Center for Health Security and an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health. Thank you for joining us on Scripps News Live. What is happening here? Why are we seeing this huge spike in cases and deaths?
What's happening is that the COVID-19 pandemic had this cascading impact on all of our other health problems, including childhood immunizations. And in many parts of the world, they've had a hard time resuming vaccinations and catching up those children that missed their shots because all the attention was on COVID-19. And measles is an unforgiving virus. It's the most contagious virus that's known to our species. And when you have decreases in vaccination rates, this virus is just going to take advantage. And unfortunately, in some parts of the world, this is still a deadly disease when it synergizes with malnutrition.
You know, unfortunately, this has become, I hate to use the word trend, but it has with many things, with prostate screenings, breast cancer screenings. So many people stopped doing those things because of the pandemic. But with something like this, with vaccinations, I feel like there was so much talk around the COVID-19 vaccine and people saying you can't force me. And that kind of put a shadow over all vaccinations, including this one. So what would you say to those people who aren't vaccinating their children because they're afraid that the vaccination is going to do more harm than good?
Well, when you look at the measles vaccine, it's one of the most successful vaccines that has ever been developed. As you mentioned earlier, it has saved tens of millions of lives just in the last decade. And this was a routine childhood infection that people got. And even in the United States, there were hospitalizations and deaths that occurred. This is a safe vaccine that's been put into billions and billions of people and has improved all of our lives. And what's happened, especially in the Western world or high income areas, is that vaccine hesitancy from COVID-19 has bled into measles vaccines, flu vaccines, chickenpox vaccines, even veterinary vaccines for pets. So what we have is an anti-vaccine movement that is energized on steroids, and we've got to combat that with the facts, because the facts and science and reason and logic are all on our side, those of us advocating for vaccines.
You know, as you talk about that advocating, I think part of that is painting a picture of what the reality is when these things aren't necessarily taken care of. How bad could this get?
Well, in the United States, we don't have some of the other cofactors that lead to measles deaths. However, what we do know is that in many parts of the world, we will see deaths increase because measles, as I said earlier, synergizes with malnourishment, access to food and water. All of that plays a big role. But in the U.S., even just prior to the pandemic, we had major outbreaks occurring in the New York, New Jersey area because of low levels of vaccination. And that's very disruptive. This is not something you want to have. Children get hospitalized. Children have to stay home from school. Major investigations have to be done by public health agencies to contact trace. And measles isn't just this little rash. It can cause pneumonia. It can cause brain infection. It actually interferes with your immune response to other infections. So other infections become more common if you've got measles. This isn't a benign disease. And I think we've got this luxury in the United States and much of the Western world where we think of measles as something our grandparents talked about as a rite of passage, but it doesn't have to be that way. That's why they made a vaccine.
So what would you say to anyone sitting at home and wondering, because oftentimes people think, did I get that vaccine? Do I need this vaccine? What would you say to those people? Because I think people don't realize how serious this is.
Well, most adults are either vaccinated or have immunity from prior infection if they were born in the 1960s. What we really want to concentrate on those children, kindergartners, people that are 5 years old, and the other vaccine, the second dose is around 10 to 12, to make sure that they're up to date. So talk to your children's pediatricians, their family medicine doctors, to make sure they didn't fall off that schedule. And I think schools need to be vigilant about what they're doing to make sure that the children that they're admitting to school are up to date on their vaccines, because it only takes a few children that are not vaccinated with the virus this contagious to cause an outbreak in a school.
You know, Doctor, you alluded to this earlier in the conversation, and we were reporting, I believe it was last week, on the drop in vaccination rates when it comes to kindergartners in America in particular. That report came out showing that it's really at one of the lowest rates, which is why it's alarming. So the reality is, because we're hearing what you're putting down, but for the parent right now, specifically with the kindergartner saying, I'm getting an exemption, because that's what's happening. They're getting exemptions from being vaccinated. We don't want to do this. What is your message to those folks specifically?
Well, the measles vaccine is one of the safest vaccines. This is an important thing that will improve your child's life. It will make your child more resilient to measles, make your community stronger against measles. And these non-medical exemptions that we're seeing rise, schools need to be much more vigilant about cracking down on them. And also states need to, because states are the ones who make that rule. But again, the anti-vaccine movement has such political power right now that it's made it very easy for people to skirt vaccine entry requirements for schools. And I think this is the long tail of the pandemic that we're going to be dealing with for decades to come.
Yeah, we're already seeing the implications of it clearly. Dr. Amish Adalja, thank you so much for joining us today. And folks, we'll be right back.